Hello and welcome to Business on the Wire. After a devastating March in 2020, here we are in April 2021 with a situation that looks like it's completely out of control for COVID. As we speak, cases have crossed 2 lakh per day in India. We also seem to have a higher number of deaths. There are question marks over the reported deaths and whether there is underreporting at this point, and the health infrastructure is once again creaking under the pressure. What's gone wrong in the months gone by? What can people do in the months ahead? And more importantly, what are the big lessons to have taken away, both for people who are trying to protect themselves from this pandemic and for those who are trying to get themselves vaccinated? It is a troubling and murky situation. And joining me to talk about that and to decipher some of what is going on and some of what has people extremely worried and anxious at this point is Professor Srinath Reddy. He is, of course, president of the Public Health Foundation of India, or PHFI, a much revered and respected face in the medical community. Thank you, Professor Reddy, for speaking to me in what looks like a particularly grave situation. How would you describe this current wave of COVID and what India is living through right now, particularly the urban cities?
I think it's a very, very worrisome situation. I would even say it's very alarming because this is a huge surge of cases, which will unfortunately translate into not only higher load on hospital admissions, but also in terms of more deaths. Because even if the virus and its variants are not likely to be more lethal than the previous version, the fact that many more cases are getting infected means that the number of cases in absolute terms who will be requiring hospitalization or even unfortunately succumbing to the illness is going to be much larger. So that is going to be the major source of worry for us. And we need to quickly contain it as soon as possible.
Is part of the problem the kind of mutation we're dealing with, Professor Reddy? Because there are many changes from when you and I would have spoken a year back since when this outbreak began. For example, it's hitting a much younger age group. It seems to be more lethal in terms of its attack. Are you seeing any specific differences this time round?
Well, let me answer each one of those questions because there are multiple components in your question. Firstly, yes, the mutants are spreading much faster and their infectivity is much higher. Whether it is the British mutant B117 or the double mutant, which is now labeled as 1617, whichever it is, the infectivity appears to be much higher than that of the previous original version of the wild virus. And that is likely to result in a much larger number of cases. And even if the lethality remains unaltered in terms of the proportion of cases succumbing, the absolute number of deaths will be much higher. But is it more severe in terms of its effect? That is uncertain because there are very different views being expressed from different parts of the world and also from different parts of India. In the UK, for example, it was initially estimated that the B117 variant is not only more infectious, but also probably resulting in more severe disease. That means it's more virulent. But elsewhere, similar reports have not come in. And even in India, we are uncertain. The same thing applies to the other mutant, the so-called double mutant. There are different versions coming from different parts of the country that some places it is said that it is definitely more lethal or more severe in terms of its clinical manifestation. In others, it is said that the hospital stay is actually shorter. So we'll have to really wait and reconcile this data. But let us assume that it is at least as virulent as earlier, and maybe it could be even slightly more virulent. But the fact that the younger people are getting affected, while it's very true, there could be multiple reasons for this. In the first instance, during the first wave, the young people were mostly remaining at home or not really moving around much. And even when the lockdown was opened up, they did not really go to school. They did not meet others as much. And even the adults were going for the marketing needs as well as for essential work. Families were not traveling for holidays or anything like that. Whereas now, even though the schools are not open, many of these people are going for coaching classes, tuitions, they're playing. Mobility has markedly increased among the young people. And families have been traveling together as well. So how much of this is because of greater exposure to the virus, and how much of it is because the virus itself is much more aggressive and is able to infect more people, including the younger people? That remains to be answered. But irrespective of what the virus is doing in terms of its variants, the protection remains the same. The same protection that you have to apply in order to prevent your acquiring the virus, getting exposed to the virus. Those measures remain the same, whichever is the virus, whether it's the original virus or a variant in whichever variant.
I want to discuss in more detail, of course, the issue of deaths, Professor Reddy. But before that, as we speak today, we have clocked 2 lakh cases across India. And there is a fear, given the activity that you pointed out, as also much other activity, including the Kumbh Mela and election rallies, that this is not the peak yet. Would you agree with that? And what do you think the peak might look like in terms of cases?
I would entirely agree, because if the virus and its mutants are much more infective at this stage, partly because they have more opportunity to spread, and partly because their own nature has become more infectious, I think the unrestricted mingling and movement of people is going to result in a much larger number. And the so-called R factor, which I believe is under underestimate, is also increasing. That means the number of people an infected person can infect in turn is now increasing day by day. So that means many more people will get infected. And I've always said that the R factor in this particular case is an underestimate, because there are a number of people who are asymptomatic who are never recorded. So you don't even know how many more are actually infected. So we'll have to definitely brace ourselves for a much larger surge in cases. And that's why there's a great urgency for concerted public health action at the moment.
Mm. You mentioned earlier, sir, that you fear this time round we will be dealing with more deaths. And that does seem to be the case already. I mean, last year at this time, it was clear that hospitals were overwhelmed. But what's different this time round is that crematoriums seem overwhelmed as well. From whatever we understand on the ground, there is underreporting with regards to deaths. In many cases, when there is comorbidity, it is not being recorded as a COVID death. First part, what do you put the increase in deaths to? And second, do you believe as well that we don't have a clear handle on how many deaths we're clocking at this point?
Yes, I think it's very difficult to estimate the deaths with accuracy when there is such a flood of cases and unfortunately a huge heap of deaths. We have really lost count. But having said that, it is not unexpected, because in the first wave, firstly, there was a prolonged lockdown when the cases were still few in number. Then there was a staged unlocking. The systems were much better prepared. There was still some movement. I mean, there were still some restrictions on a lot of movement in the country. And even some people who would have otherwise traveled didn't travel because they were worried about it. And people were still wearing masks, if not all of them, quite a good deal of them. And the overcrowding in public places and in malls and markets was not as much as we have seen in the last 2 months. So I think the fact that there has been much greater opportunity for the virus to infect many more people would inevitably and tragically translate into more deaths.
What do you think the peak might look like, Professor Reddy, both in terms of the number of cases we clock, on a per lakh basis, as also the kind of deaths we might start registering? I know it's difficult to put, a figure to this, but I'm still asking you for an estimate or what your view is.
I'm not going to put any numbers right now for the simple reason that any numbers that we put are going to be somewhat speculative because we do not know what are the countermeasures that are going to be taken. If tomorrow we suddenly decide that people are just going to be restricted from meeting in large groups of more than 5, that there will be only selected areas that will be available for public gatherings and even marketing and so on. If those kind of restrictions are imposed, and if everybody or most people start getting much more disciplined about wearing masks in public, maybe the numbers will start plummeting soon. Therefore, I will not really forecast a number because what we are seeing is only the unrestrained virus attacking at will. It doesn't have to be so. We can certainly restrict it. And that we have seen even in other places. Looking at the United Kingdom, for example. In United Kingdom, where they've gone through, again, a fairly severe restriction in recent weeks. And now they're coming out of it. And it's not ascribed to the vaccination. It's entirely ascribed to the public health measures that they've followed. And that has had an impact. We have seen this time and again in Europe. Whenever they actually do impose stringent measures, the virus is contained. It's only when you suddenly unlock and release and people move around with gay abandon, then the virus gets a second lease of life to spread around. So I think what we need is not only a strict enforcement and strict levels of personal discipline now, but also sustained for several weeks and with very slow release again until we actually are sure that we have contained the virus and also use the vaccines that we have to good effect to protect the vulnerable people.
Some restrictions have come in place in localized format. I mean, Delhi has now announced a weekend curfew. Bombay and Maharashtra have its own restrictions. There are night curfews across many cities. Do you think that is enough? And do you think this helps the cause? Because many question marks have been raised about the efficiency of this model, shutting down just for 2 days or shutting down for the night and then reopening in the morning.
Well, I think the problem was that when the car is at full speed, you may not be able to apply the brakes suddenly. So I think they've started slowing down and shifting gears now. But I think we do need even stricter measures now. I'm not calling for a full lockdown, but certainly restricting the number of people who can gather outside. And that also has to be for essential work and essential marketing needs. And making sure that we maintain that for quite some time at a stretch. And making sure, again, that everybody wears masks. And I'm quite in favor of the government distributing masks to every house. Let every state and government do it. Every household can receive 4 or 8 masks, depending on the number of members there. If nothing else, it sends a symbol. And then making sure that citizen networks in the community are activated in order to make sure that there is adequate adherence to that. You just can't depend upon the policemen to enforce discipline. You have to make people aware that this is something that is needed to protect them and their families. And those kind of messages are actually best communicated through the local citizen networks of trusted voices.
Professor Reddy, one is the laxity displayed at an individual level that may have, got things to the point they have. The other is the outright measures or moves that simply make no sense, such as the kind of election rallies we have seen, the mass gatherings where literally no one is wearing a mask. We have a huge religious festival underway or religious ceremony underway, which is the Kumbh Mela, where it looks like we will come out with a super spreader event. We also have, as you pointed out, a lot of people traveling on non-essential work. A lot of movement is happening between cities. As a public health individual, are you shocked? Are you saddened? Because the individual citizen is, when they see all this, how do you rationalize this?
I'm actually very greatly saddened. Partly, I think we also in the public health community must take some responsibility for it. Because some of us, not I, but some of us, have actually gone around talking a lot about herd immunity. And they said we have attained this nirvana even by January. And that sort of message percolates to the public as well as to the policymakers. And then people started saying, okay, Indians must be genetically protected. Indians must be protected for 10 different reasons. But at least some of us were warning that, no, this is illusory. Don't let the guard down. But I think everybody wants to get back to normal life, and they're clutching at any straw of hope. The businessmen want to get back to full business industry production. The small trader wants to get back to business. The politician would like to get back to their business of elections and campaigning. And cricketers want to get back to cricket tournaments. So everybody thinks that normalcy has returned, and you do not pay heed to the voices of caution. And now we are paying the price for that. So I believe there should have been much greater resolute commitment to enforcing these public health precautions for a sustained period of time. In January, when somebody asked me, how long should we remain cautious? I said, at least till the end of April. But that didn't happen. And you asked me whether I'm saddened. Of course, I'm saddened at the tragedy that has unfolded.
Would you also say that there is a lot of deep thinking to do in terms of political leadership and administrative leadership? I was watching another interview with a health specialist where they were asked why this has come to pass, and her answer was hubris, complacence, data denial. Maybe I would add data suppression to that. None of this, of what we're living through right now, is something that we didn't live through last year, so particularly with regards to the health and medical infrastructure. Yet here we are a year later in not much different shape.
I entirely agree that there was a great deal of complacency and a premature celebration of victory across multiple sections. You should have seen state chief ministers declaring that, oh, we have attained herd immunity and we have ended the pandemic. And no. And when public figures do not wear masks in public, then it becomes very difficult for the ordinary citizen to be convinced of the need. Yeah. So those are important elements. But I'd rather not sit on what went wrong. That is for the future to, really analyze. What I really at this point want everybody to focus, all minds to focus, is on what we must do now to contain the pandemic and the threat. And there, I think the solutions are fairly clear, if only we exhibit the resolve to implement it. And that is, make sure that we do not give the virus an opportunity to infect us. So whether it is the wild virus or the variant virus, there are only 3 portals of entry: the nose, the mouth, and the eyes. So protect your face well with a proper mask, and if possible with eyeglasses. Make sure that you do not give the virus a chance to transmit from person to person by following physical distancing and avoiding super spreader events. The biggest danger is in super spreader events. And that is what we have actually given a license to in the last 2 or 3 months. The number of super spreader events that we have permitted is unbelievable. And if we can actually clamp down on those right now, then at least we can start the business of stopping the virus in its tracks in terms of transmission. Then, of course, try and accelerate the vaccination program so that you're protecting the vulnerable and you're also, over a period of time, reducing transmission. These are the only simple solutions that we have. While it is pleasing to the scientists to try and discover and discuss as many variants as possible, that really is not going to make an immediate difference to the strategy that we are going to adopt to contain it. The strategy is very simple. Let's not complicate the matters.
I do want to talk about what to do at an individual level, Professor Reddy. As you pointed out, some of it is already obvious and already exists in terms of wearing your mask well, protecting your eyes, trying to work from home, avoiding stepping out. Some suggestions have been made by state health advisories as well, saying that it's probably time to be wearing a mask at home. Would you agree with that advice? Is that something people should exercise?
Well, if anybody is suspected to have an infection, whether the test is positive or not, one of the things I must again repeat is a negative test doesn't always rule out an infection.
Yes.
If a person has been heavily exposed to another person, even if the test is negative, one has to presume that the person would still be manifesting the features and may turn out to be positive later on. So if anybody is either infected and is being treated at home, or has had exposure and is therefore suspected to possibly be affected, even if not actually diagnosed to be so, then everybody else in the house must wear a mask. There's no doubt about it. Otherwise, if everybody is safe from it and is keeping safe, then I don't think it's necessary to wear a mask in the house. But do try and keep some degree of distancing if possible, even within the house.
That was my second question, actually, Professor Reddy. Reports do indicate also that the new mutations are not showing up in the RT-PCR test, even though individuals are displaying symptoms of COVID as we know it. What should one do in that case? And the second part of my question is, now there is a rush to get additional testing done because we know a little bit more. So, test your blood, get an X-ray done, get a CT scan done. Should one go down that road, or does that create unnecessary pressure on an already heaving health infrastructure?
Well, let me make two statements. First is, I think, just like in the case of herd immunity, the diagnostic accuracy of these tests was hyped up a lot in the first instance. We know for sure, even from the beginning, from international publications, that the sensitivity of the RT-PCR test in order to detect a replicating virus is only 60 to 70%. And the ability of the rapid antigen test, when compared to the RT-PCR, is only about 50 to 60%. So the rapid antigen test misses a large number of cases, and even the RT-PCR test does miss a number of cases. And there are several reasons for this. Firstly, if you do the test too early in the infection or too late in the infection, you may not be able to capture a replicating virus. Then, if your swab collection technique is poor, then you will not be able to gather the sample adequately. If the sample is not properly transported or stored in the laboratory for testing, then you can again have problems. So there are multiple reasons why the test could go wrong. And now many more laboratories are performing these tests with many technicians who are not properly trained, who are not properly collecting the swabs at home, not properly analyzing it or properly transporting it. So it's not surprising that you're getting a large number of negative tests. Well, the prescription abroad is that you do more repeat tests. You try and test twice or thrice. But right from the very beginning, hospitals abroad have said, even if the test is negative, if the symptoms are very clear-cut, then we'll do an X-ray test, we'll do a CT scan, and we'll treat them. And even in some of the clinical trials, they've even taken the clinical presumptive diagnosis as proof of COVID-19. So depending on a single test result or the result of one test, believing that the test positive is always disease and the test negative is always no disease, that's incorrect. The second part of it is, do you need to do more tests? A diagnostic test must only be driven by the management decision that follows it. Now, if a person, for example, is likely to be COVID positive because the person has been exposed, but the test is negative, the person is not having breathlessness, the pulse oximetry is showing good oxygen results, 96, 98, 97, whatever, and doesn't appear to be getting into trouble, there's no point in dragging him to a hospital and getting an X-ray test or a CT scan. On the other hand, if the person is breathless and the oxygen saturation is dropping, then certainly get to the hospital. And if the test is negative for confirmation, you will invariably, in such a breathless person, do an X-ray test. And if necessary, do a CT scan. But just for pinning the diagnosis of our COVID positivity on a person who is otherwise doing quite well and can easily be managed at home, would be foolish and foolhardy to drag all the way to a hospital.
I think that's extremely important advice for everyone listening, particularly because of the panic levels that are raging right now, where people are being pulled into tests with symptoms which seem quite mild at this point. Which brings us to the situation of the vaccines, Professor Reddy. Enough has sort of gone down in terms of finger pointing, but would you say we should be prepared for a period over the next few months where there will be a shortage on vaccines?
Yes, there will be, because now we are seeing definitely that a larger number of people are being targeted for vaccination, and age group wise. And the availability of vaccines is coming into question now, partly because the Covaxin production volumes have not really ramped up as fast as we were hoping for, but we hope that will happen. With the AstraZeneca vaccine, some question marks have been raised internationally. But if the stocks that are available in India can be fully available, then we will possibly have some of those stocks also. But nevertheless, they'll not be adequate to really fill the expanded supply chain. I mean, if the supply chain has to flow in full volume because of the requirements, we require more vaccines. And we have now permitted more vaccines to be given the regulatory approval, and some of them will be manufactured in India. And now with the Russian Sputnik V vaccine coming in, though initially it was mainly meant for the export market, if a substantial portion of that can also be available to India, certainly that will help us. But whether the other vaccines can also be manufactured in India and increase the supply chain in a couple of months' time, that is possible. But at least for the next 2 months, we are going to have some constraints.
What do you do if you've been administered one shot and have now been told that the second shot may not be available at the scheduled time? And what do you do if you've had one shot and you've tested positive for COVID in the middle? Because there is a section of population that's dealing with both these situations.
Well, if you have had one shot and the second shot is delayed because of supply constraints, take it whenever you can get it. And in the meanwhile, and even after the second shot, do follow the other public health precautions of keeping masks and away from the crowds till the larger part of society is vaccinated and immune. Therefore, you just have to keep yourself protected and take the next shot whenever it is possible. On the other hand, if you have already had one shot and then got COVID, then it's likely that your COVID infection may act as the booster shot. But still, it is advisable after a period of time to take another shot, because a shot gives a standardized exposure to the antigen, and therefore you're likely to get a predictably strong immune response. Whereas an infection gives a variable amount of antigenic exposure, and therefore your immune response may be variable. And sometimes it may be strong if you have had a huge viral load exposure. If it is a very mild viral load exposure, your antigenic response, antibody response and immune response may be on the lower side. So while for a person who has already been infected and who already has had one shot and then gets infected, some of the international groups are saying that you don't need to get a second shot. That's because they want to spread out the vaccine to as many people as possible. But if you are asking me from the point of view of individual protection, I would say go ahead again with the second shot if it is available.
Is there reason to worry, sir, about the news flow around the vaccines? I mean, as you mentioned on AstraZeneca, there are blood clot concerns. They came up for Johnson & Johnson as well. Some questions have been raised about the nature of the vaccine being different in terms of what is provided in Europe versus what is provided in India. The characteristics are changing around for Sputnik V, people have pointed out. It's difficult to disaggregate all this information for the ordinary person and really sort of understand what's going on.
Well, one of the things that I think we must keep communicating is that these are serious but very rare adverse events. We still have to get to the bottom of why these are happening. because these happen to be autoimmune reactions which reduce the numbers of platelets or the cells that are responsible for clotting in the blood. And paradoxically, they seem to activate some of the proteins which are responsible for clotting. And that results in venous thrombosis and sometimes even arterial in somewhat unusual parts of the body where normally it doesn't occur. Now, why is this happening? Why is this autoimmune reaction happening? Why is it happening mostly in women in the reproductive age group? These are still some questions to be answered. Why is it happening only with the virus vector vaccines where an adenovirus is being used to transport the DNA code for the spike protein? Is it the DNA that's the problem? Is it the adenovirus that is the problem? We still do not know the answers. I think they need to be investigated. As a matter of abundant caution, some countries have said we'll not give it to young people because they may not say that, because some young men also have been affected, but mostly young women have been affected. But they said we'll not give it to people below 50 or below 60 or whatever. But right now in our country, as far as the authorities are concerned, they've said they've not had any reports of any adverse event. And why we are better protected than others, we'll have to wait and see. But till that time, even as we must try and document any adverse event and analyze those reports very carefully, I think the vaccine can continue to be administered.
One final question, Professor Reddy. I know you're not one to look behind and point fingers at what went wrong, but there should be some lessons to take away, I hope, from what has been a devastating year and a half. Would you say there are important takeaways for people to absorb, not just in terms of their public behavior, but the fact that perhaps vaccination drives were not as fast as they should have been, the fact that we do seem to have some administrative breakdowns, which is why we've got the situation we do in urban cities. What do you think we need to take away from this? Because people have been struggling now for 2 years with this.
Well, the lessons are respect science, respect public health, that public officials must have an agenda which goes beyond their electoral agenda. They must ensure that public protection and safety comes uppermost. And if you listen to good science patiently, then you will not give in to the notions that there is herd immunity and then you can do whatever you want, you can allow super spreader events to go on, and so on and so forth. I think those are important. Second is communicate with the people, take them into confidence, share the data, but interpret it well, and engage citizen networks so that confidence builds up, adherence to advisories is improved, and local networks are the best defenses against the spread of infection in terms of people following the right kind of behavior and not allowing false beliefs to be propagated. So those are important. And lastly, decentralize your response. Unless you do it at the district level, in fact, I would even say mohalla to mohalla level, but district administration is important. And the conditions vary from district to district. So even now, every district in the country may not require a lockdown or even a severe restriction of public movement like a Section 144. But some districts may need it. So try and decentralize your response. These are some of the important lessons I believe that we must carry. But the most important is, even if there is much to understand about this virus, even if there is much to understand about how this epidemic is going to evolve in the further time, act on what we know. First is prevent super spreader events and try and get everybody to have facial protection against entry of the virus as much as possible. And that is the only way to contain the virus while we are accelerating our vaccine administration. And ensure that people who are actually going to be seen in the public view as setting policy are following the rules that are being prescribed for the ordinary citizen.
It's only that the ordinary citizen doesn't have access to the kind of support that those who willfully do not use a mask do. So thank you very much, as always, for this conversation. I think for people listening, there is so much to have absorbed, and hopefully for those who are in power as well, to think about in the months ahead. Thank you again.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.